Again, we're talking about those individuals with a knee that's arthritic. They've lost that articular cartilage. They're not quite ready for a knee replacement yet. They're trying to keep that off. Steroid shots, maybe they've done a couple here or there. Maybe it helped, maybe it didn't. But the reality is that doesn't feel like that's the right thing for them. We're not just trying to put out an acute fire. We're trying to get them some runway to be able to rehab and get stronger, but we're running into these barriers. And we've seen mixed results with those over the years, and I really don't know what to make of that either. So I just wanted your take on that. Like, do you feel like there's a patient selection that you're like, other than them saying like, I'm willing to try it? You know, is there a time that you're like, hey, I really think you might be an indicator, like I've seen this on your exam or your history, that let's try it? And if so, with those gel injections, have you ever seen, other than the fact that insurance says, hey, you only qualify for the one-shot version, or you get the series of 3, or you get the series of 5, have you seen any difference with these? Because our understanding of this is a little bit of a challenge, because I don't think that if we went person to person in the room, we would super understand the half-life of how long that's staying around in the tissue, what's really going on with the mechanism. I would just love for you to speak on that.
Yeah.
Just unpack that as much as you can so that everyone here feels a little more educated on that topic and what's helpful.
When I was taking my oral boards 10 years ago, like one of my examiners was like, oh, well, what's the mechanism of viscosupplement injections? And the answer is, we don't know. Like, we're not sure how it works or what. And like scientifically, we don't really know.
Okay.
My personal experience is that I feel like it works better with mild arthritis. So I think if you don't have cartilage in there to work with, like someone that has bone on bone grade 4, like I don't feel like that's going to be an effective option. But if they have milder arthritis, I feel like it works better. Is it because they would have just gotten better anyway? Because they have milder arthritis, like that certainly is a possibility. I feel like the formulations, when you have like 3 or 5, they generally get a little bit more total medicine, like as far as the how urinate, the quantity that they get a little bit more, and it's just spread out. Whereas the one and done, the appeal is like you don't have to have 5 shots or 3 shots, but it is a little bit less of the total quantity of the medicine.